Good day, everyone. This is Dr. Dennis Batangan from the Philippines, from the Ateneo de Manila University in Quezon City, Philippines. I'm joined here in this session by Dr. Peter Drury from Drury Consulting Limited, based in the United Kingdom. The session for this afternoon is entitled Mapping Morbidities and Vulnerabilities for Social Inclusion, the expanded use of non-communicable diseases risk assessment tools. We'd like to thank the organizers from the union and the Community Connect team for providing us this opportunity to share these discussion points regarding the use of NCD or non-communicable disease risk assessment tools for for morbidity and vulnerability mapping for social inclusion. With that, I'd like to start now with the recordings or the presentations, and then we'll proceed immediately to the Q&A part, for which we'd like to really encourage people, participants, to post your questions and clarifications or comments in the Q&A part, and we'd like to have more time for that in this particular session. So, can we start, Marina, with the recordings? Everyone, this is Dr. Dennis P. Patangan from the Philippines, Ateneo de Manila University. I am the chair for this panel on mapping morbidities and vulnerabilities for social inclusion, the expanded use of non-communicable diseases risk assessment tools. The objectives of the session are as follows. The first one is to discuss what enables a digital health ecosystem to evolve so that risk assessment tools provide optimal interventions and programs. This will be tackled primarily by Dr. Peter Drury. And I would like to focus on the next two objectives, which is to interrogate the expanded use of NCDs, risk assessment tools in analyzing morbidity patterns, associated vulnerabilities, and how these tools can facilitate social inclusion of affected individuals. And the third would be to understand how disease-specific recording and reporting tools can serve to improve access and efficiency in the delivery of social services and health programs. As a brief context now for this session, I would like to start by pointing out that disease-specific risk assessment tools usually focus only on the individual risk factors associated with the disease. And we realize as we go through this risk assessment process that the risk factors, however, result from a confluence of social economic variables predisposing certain population groups to certain disease patterns. In this session, we'd like to discuss also related topics on gaps in the communicable diseases and non-communicable diseases comorbidities approach, low spending in social sectors and health programs, weak poverty targeting systems, and lack of institutional coordination, which then results in effective and low impact programs. What I would like to present as a use case is the development in the Philippines of the multi program local mapping tool for non communicable diseases. This is an electronic NCD recording reporting software application which also filters comorbidity and vulnerability conditions of patients, such that patients who have actually multiple morbidities and in more vulnerable situations can be identified and prioritized. These are the features, no, of this NCD Muplum. It actually has a dashboard which shows key statistics and visualization of such as graphs and charts for NCD data. It also has it, it also has geographic maps and a patient registry, as you see in the screen, which lists the patients in the database, including the facility, visits, and treatment or management records. And it filters parameters such as NCD program by age, sex, vaccination status, as well as what we have identified earlier as comorbidities and vulnerabilities. At the same time, it generates reports for target client list per registry, formatted required report for specific NCD programs, specific, of course, in the Philippines, And it has a feature on deduplication for data quality check and electronic triads for prioritization. In the panel discussion, we hope to be able to go through these following learning questions in relation to this topic on mapping morbidities and mortalities for social inclusion. Number one is, how do development programs prioritize and address inequity issues? How can risk assessment tools help to identify what are comparatively most optimal interventions and programs? Again, using the data coming from these risk assessment tools. What social vulnerability characteristics should determine the prioritization of benefits after, of course, analyzing the results and the interventions, the results of this data aggregation and the results of the intervention? And what is the impact of individual characteristics and contextual factors on selected intervention programs? And finally, we want to understand how do social vulnerability factors evolve for certain population subgroups. No? What vulnerability characteristics emerge from specific subgroups? For example, for older persons or persons with disability, women and girls are as they participate in development programs. So we hope that these particular learning questions can be tackled, in the discussion part of our Community Connect section. So thank you for listening to this introduction to this session on the topic mapping morbidities and vulnerabilities for social inclusion, the expanded use of non-communicable disease risk assessment tools. Good day, everyone, and we welcome your inputs, your questions, and we hope to have a very engaging discussion in these community events.
That is dealing with mapping morbidities and vulnerabilities for social inclusion, the expanded use of non-communicable disease risk assessment tools. My colleague Dennis Batangan, who's really been the key guy on this whole program, will be speaking second. But my task really is to just introduce briefly the objectives of the session, which are three. Firstly, to look at what enables a digital health ecosystem to evolve so that risk assessment tools can provide optimal interventions and programs. Secondly, to interrogate expanded use of NCD risk assessment tools. And then thirdly, to look at disease-specific recording and reporting tools. Dennis will cover the second two objectives. I'm going to address the first one. So, evolving socially inclusive digital health ecosystems. Why is this important? And let me just say I'm going to step through this in a very straightforward sequence to deal first of all with the issue of evolving. So we're talking about mapping morbidities and vulnerabilities for social inclusion. And this is in the context of NCDs and risk assessment tools. But risk assessment digital tools are just one element of digital health ecosystems. And whilst they are really important in their own right, as Dennis will convince you of, I'm sure, what I'm trying to get across here is that they are part of a broader ecosystem. And to really get full value, we need at the same time to be considering the other aspects of the social and technical issues that surround the use of digital tools. And the term evolution, to me, it implies learning from what works well, really for the end user. How do we know what really works well for them? What also are the range of tools on offer? And how do we learn about what's worked well elsewhere? Well, obviously, attending conferences like this is a good way to do that. But how, having learned and put those ideas into practice, how do we share what we've learned? So there's an issue that essentially is saying this is an evolving process. It's a continuing process of learning and sharing. To be socially inclusive, I thought I'd use as an illustration, a lung-related issue, and just give you a flavour of what an interesting report on COPD in rural Australia came up with. And this was a BMJ Open report of 2019. And essentially, what they were stressing was that community inclusion enhances patients' ability to cope and ultimately manage COPD, obstructive pulmonary disorders. And this is facilitated by living in a supportive village environment with known colleagues and doctors and healthcare teams willing to go above and beyond. So it's important to understand and supplement these networks and assist people to manage. So to improve the management of lung disease, clearly there's an awful lot of social and health system work that needs to be done. But underpinning that are some issues around digital tools. And in the paper, they had an interesting diagram, at least an interesting one to me, that was saying what was positive were things that were encouraging inclusion, and what was negative were those that actually left people feeling isolated. And you can see that in the little box diagram on the right. And I just thought it might be interesting to think, well, okay, what are the ways in which some digital tools might help? So if we take the issues to do with the role that facilitators can play to help people cope with their strategies, coping strategies, well, there are plenty of apps that are available to help guide people through the issues around how do I cope with this problem that I've got, knowing when and where to seek help. Again, there are plenty of digital apps that can help people do that. Providing social support, organising social support, digital tools also have a role to play there. Acknowledging that there may be a lack of clear communication from the health team to people, again, encourages us to think about the ways in which digital technologies can be used to assist both the frontline health worker and the client to get good quality support. And indeed, to understand better what the actual community parameters might be, the sort of challenging social, cultural, and economic conditions that are relevant and prevalent in the area of concern. So the facilitators, the frontline facilitators, have a hugely important role to play to make the way in which we support people with lung disease socially inclusive. And the more we can do that, the better their chances of managing their conditions well. So the digital health angle, you'll see from what I've said that actually there are different types of stakeholders that are using digital tools, patients, frontline staff, and then of course management and policymakers need to synthesize the outcome of the data that's been collected and figure out what better decisions can be made. So there are also all sorts of other challenges around this. Do we need digital tools for different conditions? How do we address the opportunities that there are now with rapidly improving price and performance of digital technologies? All of this, to get full value, relies on there being a good infrastructure in place. So how the particular tools and technologies that may be relevant and supporting a frontline health worker or a patient or a management team, how is that all to be underpinned by the broader digital health ecosystem that is surrounding them? How can all this be managed? So the last slide is to focus on digital health ecosystems. So they are part of the health system, a part of. And first up, in my view, almost always is to consider the users. What is it that the users of these systems want? And how do they engage with the professionals that are then going to respond to their requirements? How do the professionals express what is required in terms that can be translated into what digital tools and solutions and systems can offer. So what are they? What are the tools and systems that are available? And then how do we address the issues of social inclusion? And although what I've said has been largely framed around the individual, of course, there is the issue of mapping communities. And that, I think, is a nice segue for me to uh, hand over to my colleague Dennis, who will talk to you in much more concrete detail about the program of work that he's been masterminding in the Philippines. Thank you very much indeed.
Thank you very much, Dr. Peter Drury, for that presentation, no, on mapping vulnerabilities, particularly highlighting the issue of social inclusion, no, within the certain spectrum, no, inclusion and exclusion, and also within the context of ecosystems, no, and how it actually plays into a particular type of interrelated, how these particular actors play in an interrelated way. Yeah, so with that, we'd like to open the floor now for questions, comments, or clarifications or inputs that our audience might have regarding those two presentations. But in the meantime, I'll probably ask Peter to elaborate further on that context of the spectrum of inclusion and exclusion, specifically the role of digital health, no, in facilitating or in facilitating inclusion with to certain patient groups. No, you mentioned about the report from BMJ on COPD patients. Do you think it's applicable to other groups of patients? That particular framework that you presented here.
Yes, I do. And I think one of the helpful things about that particular example actually was that it stresses something that we all need to kind of bear in mind. And that's not just the issues around understanding the age or the sex or the urban rural characteristics of the people, but actually what they were stressing was the need for people to be understood in the context of the community that
Mhm,
they're living in. So part of the challenge for introducing digital technologies and support is to be thinking, how does this help our communities become better informed and better connected? And that means not just communities of people, so that they know that they have got peers or friends that they can talk to and communicate with. And obviously social media and Facebook and all the rest of it has vastly increased our level of social integration on a good day, disintegration on a bad day. But essentially, that focus on establishing a network of people, citizens, is one thing.
mhm,
But then the way in which they can engage with our health service
mhm,
staff, broadly construed. So within the health sector, again, the way in which digital technologies can be used to help the frontline health worker feel engaged and supported by their management, that their issues are understood, the data they collected is reflected on, good decisions are fed back to them, and good knowledge support is provided to them so that when they are in front of patients, either in a clinical setting or at home, they have got the ability to give good, contextually appropriate advice. So it's not just the point about all of this, it isn't just about the tool itself, although that is important. It's how these things all work together. And to me, and I made the point in the presentation, this is about a social and a technical system
mhm,
combined. It's not one or the other, it's both. And therefore, I think in discussing this and in responding to questions that people may have, that's really what that's the theme that I'm trying to elaborate on.
mhm,
How is it that we can understand it in a socio-technical community, citizen and professional way? That's the approach rather than particular tools.
Thank you for that, Peter. Actually, in the literature, they mention of a socio-technical or a techno-governance, no, approaches to the use of digital technologies, particularly in settings, no, new settings, for example, or new groups, no, that are going to use these technologies. I actually see familiar names, no, from the Philippines among the audience, and also we'd like to welcome, no, our participants to this community connect session, and we see a lot of interested participants, and would like to encourage you to post your questions or probably share your comments via the Q&A part, no, of this forum, or I think you can also use your microphone, no, to give your question or comments. Yeah, while we're waiting for these questions to come in, I'd like to highlight what we presented as an experience of the Philippines, no, in the use of a non-communicable risk assessment tool to be able to identify certain subgroups in a community who are more vulnerable than the rest, no, by pointing out through the use of this digital tool who among in the subgroup or in this population group have uh, multiple morbidities and vulnerabilities. We realized that in the Philippines, for example, in the non-communicable disease program, aside from the specific non-communicable diseases that are being mapped and actually being monitored through reports, the non-communicable disease program in the Philippines includes the monitoring of older persons and people with disabilities. So what happens as we develop this particular mapping tool is that we were already looking into registries of patients who had hypertension, diabetes, cancer, as well as people or registries for older people and people with vulnerabilities. So it was the next step was actually to identify who among the members of these registries or people in the registries had multiple morbidities and vulnerability. So we're seeing that as an expanded use, no, of these risk assessment tools for NCD. And probably for those who would be interested to learn more about this, we could communicate probably even after this session to be able to discuss those in more detail. Yeah, probably I'll go back to Peter on the ecosystem part, which was actually the last part of your presentation, Peter. Among those players, no, that you have mentioned, are you saying that the most important part is the relationship between the users, meaning the users of the technology and the beneficiaries of the technology? Is that the main thing or the main part or the main relationship that we should be looking into when using these digital tools? Peter, you're on mute.
For
Yeah.
me, the key um, point is that these are all part of an ecosystem. So once you accept what that means, then in a sense there's no key part. The key part is the whole ecosystem. So everybody has a role to play, and that to me extends to understanding how multiple morbidities can affect the same person, how frontline health workers are able to deal with what may present as actually really quite complicated cases because you've got a number of things layered on top of each other. So how do we help citizens know when to attend, where to go? How do we help frontline health workers understand the signs and symptoms that they're seeing and then make good decisions as to what the best treatment protocol is? And when you're dealing with NCDs, of course, it's also to do with engaging the wider community, because NCDs reflect a cultural perception about what is acceptable and tolerable and what isn't. So the way in which we, as whole communities, actually understand and use technology to the benefit of our physical and indeed mental health, it is also part of the ecosystem. So that's why I think, you know, the ways in which our media are better informed about the importance of understanding the challenges of dealing with lung related health issues is actually an important part of trying to make our ecosystems more healthy. So I wouldn't put my finger on any one individual point. I think that the key point is to try and take a more holistic understanding, work together and learn from each other as to what works well, because it is also true that, of course, cultures and sensitivities vary within countries and certainly between them. And therefore, the importance that's given to certain behaviors varies. Okay, so things have to be adapted to reflect that. But the, the fundamental principles are that we need to be able to bring together and use digital technologies to assist as much as we can to bring together understandings about what the threats are to ill health and how to avoid them. And if you do get sick, where best to go to get treatment. And for those providing treatment, how do they how are they assisted in getting contextually relevant information at their fingertips so that they can provide good advice and then be able to track that person back into the community so that you can reduce the amount of chronic ill health, if at all possible. So it's a very rich picture that emerges, and I think sharing the richness of that rather than focusing on a particular issue within it is the important point, really, to try and get across to people.
Yeah, thank you very much, Peter. There's a question here, no, but I'll try to point out some things, no, before I give the floor to you. But it's related to what you're discussing, no. The question is: this digital health ecosystems might be associated with One Health perspective. Yeah, my sense on this is that yes, actually, because the One Health thing is actually a very broad frame, no, that we have been discussing in the past. There is the newest buzzword, I think, no, on One Health perspective, but it has several levels, no, I think. No? In the case of the work that we're doing on non-communicable disease, the first layer is actually to bridge the non-communicable part to the communicable programs, no, and that's one because of the very verticalized and very compartmentalized nature of our health programs. We need we need to exert effort to bridge these different programs to be able to talk to one another in terms of recording and reporting systems. Of course, in the broadest context of this One Health perspective, no, it's actually looking at how human health relates with animal health and even plant health, no, and that is I think a broad enough framework to be able to navigate between the different programs affecting specific groups, no, and that might even cut across not only the health part, no, but even the non-health, or what probably what others consider as non-health part, moving into the more developmental or social development programs part, no, to be able to address the concerns of a particular group or subgroup. But moving on to digital health ecosystems, no, probably we'll go back to what Peter was discussing earlier, in terms of the in terms of how to look at the digital ecosystems and what particular value we should put into to the players, no, that are actually at play with these digital health ecosystems. Peter, you might want to continue on that particular note.
Yeah. Okay. Thanks, Dennis. I think so far as more specifically on the digital side goes, one of the things that I think has been really interesting in the work that we've been involved in the Philippines with the MUPLOMP tool was to look at the mapping capabilities, because the way in which you can understand how individuals' ill health actually makes a pattern when you look at it as a community or as a population. And when you can map where people are living and residing, and then look at all the other social and economic factors that are affecting them. In our context, that was primarily in an urban setting, but the principles apply in rural as well. Then you can begin to get a much richer picture of the nature of the ecosystem that is surrounding people who are suffering, in our particular case, from NCDs. But as you were saying with the One Health example, communicable diseases too are, it's important to understand what the whole disease ecology is. And digital tools can help us do that. But one of the challenges, I think, that it's just worth flagging up here, but equally it's one of the opportunities, is that as we understand what goes on within the health sector a bit better, so increasingly we realise the need to engage with what our local authorities and the education sector are doing, and the housing sector, for example. So thinking about this from a digital health ecosystem point of view also means that you need to be as clear as you can be about what the interoperability standards are, or could or should be, so that you can exchange meaningful data and information with colleagues who are working in different sectors, so that you build up a richer picture of what the patterns of ill health are. Now, obviously, there are fundamentally important issues to do with privacy and personally identifiable health information. But the ability to look at the health of aggregated populations in a broader context can lead to very rich insights into where you can get best value for money in terms of reducing the likelihood of people suffering from an NCD. And I think we need to understand that as we invest in particular digital solutions to get best value out of them, we have to pay attention to how that data can be used in aggregate and in ways that enable sharing both within the health sector and, where appropriate, with the other sectors that may have a relevant interest for us. So that would be my thoughts on that question that you posed. Thanks,
Yeah,
Dennis.
thank you, Dr. Peter. We have a question here, no, for both of us. The question reads, in a more rural context, particular South Africa, with very variable digital connectivity due to availability and high costs, no, are there any alternative platforms to USSD that are promising for enabling access to digital tools? I think the issue of connectivity, no, internet connectivity, when we talk about digital health or digital health intervention, is a basic issue. And there are different, or we've tried different, for example, in the Philippines, and we've tried different ways of addressing this connectivity issue. One example, one approach that we do is actually to have an offline mode, for technologies that need internet connectivity for reporting. Meaning, the devices or the technologies or the tools, the softwares, can actually be used in an offline mode when there is no internet, and the data is stored temporarily in the device, and then it is actually uploaded during the time that there is an internet connection. So that's one particular workaround, no, or technical solution that we have seen also here in the Philippines. Yeah, so yeah, I'll give the floor to Peter, who has actually more experience and more work with
Yeah, thanks, Dennis. And just another thing, and I've done this myself in Lao PDR, which is also a very rural area, poor, etc., um, and where connectivity is very challenging. And what we were focusing on there was trying to help communities get better information. This was with some work being led by UNICEF, so it was particularly focused on maternal and child health issues. But essentially, what we did was to put some video clips and cartoons and films onto SD cards that you can put into a mobile phone and run from that mobile phone. So you're not dependent on connectivity. What you do is actually giving, in this case, usually the village chief, an SD card packed with good quality information and knowledge support. And I think as the price performance of a video comes down, so we're going to be able to do much more in that particular aspect of digital health. So it's not just about sending messages to people, it's about communicate to and from and data. It's about being able to use technology to convey locally engaging for that particular community, locally engaging, language relevant content. And I think that whole aspect of digital health uh, remains to be developed. Let's put it that way.
it.
So I think in rural settings in South Africa too, yes, by all means, the USSD clearly has a very important part to play, but there are other ways of getting the most from digital technologies in an offline environment as well. That's one of them.
Yeah, yeah. Thanks for sharing that, Peter. We move on to another question, no, in the Q&A box. No, the question says, possibly a bit too specific, but do you know of any good examples of mentoring platforms for NCDs that could support integration of NCD services within TV services? In our work with NCD in the Philippines, we've seen some well, they call it the comorbidity approach, no, meaning looking at tuberculosis and non-communicable disease, particularly diabetes. So I think there are existing modules, platforms for working, no, on this particular comorbidity area. The other thing that we did with the Better Health program in the Philippines was actually on gestational diabetes mellitus, which is actually the convergence of the maternal child health and nutrition program with the diabetes program. No? So it's actually bridging the public health or the public health MCH nutrition and a more clinically based NCD program on diabetes. I think there are several lead or prototype programs on this, which actually looks on integration. But I think, you know, this area of integration between and among different disease control programs and even public health programs is really a way to go in terms of making the approach more holistic and of course more developmental, no, and more sustainable as well, no, in the long term. Peter, you might have experience on this, on the
No,
integration of.
I don't have much to add to that, Dennis. I think I'd rather leave time for other questions to be asked and answered. I don't want to add more to what you've already said. I think that's fine.
Yeah, okay. This one is specific for you. Thank you, Peter, for recognizing that connectivity and access equally affects the community for health information as healthcare workers for accessing and uploading information. Any rejoinder on that, Peter?
No, as I say, I mean, I think once you kind of get the idea of an ecosystem, so you've got health workers and everything that sits behind them, and citizens and everything that sits behind them, and you understand that you have to work in the context of the particular state or the district that you're in, then it becomes a little bit easier to begin to make some good decisions. It's easier to take particular things, particularly if there is a donor with money who is wanting to address some particular challenge that they perceive as being important, which is why I think it's always important for us to try and make sure that it's the users and the local health communities that understand the challenges that they're facing and how best to address them, to be the ones who are setting the agenda for what it is that will help them most. And that's particularly true in the case of digital tools, and the dangers of having, or the risks of having disease specific technology, I think, are very high, particularly in low resource situations. So that's all I would say on that point. Dennis, thank you.
Yeah, thank you, Peter. I think we have time for last one or two questions, no, before the session ends. In the meantime, I'd like to yeah, just to greet colleagues from the Philippines. No, shout out to from the groups in from Bataan, no, from the PBS Philippine Business for Social Progress, and I think some colleagues or some previous colleagues from USA are also in the session. We really thank you, no? And of course everyone who attended the session and posted their questions. We'd like to thank you, no, for your time, no, for this particular session, and probably this could we could continue on the discussions, no, even after the session if you would. I think the union would have the platform and possibilities for continuing on the discussions on topics such as the one that we are looking into at the moment. So actually, we'd like to probably there are no more questions or comments. No, probably we have a last points, no, or last words from Peter and then myself, and then we'll close the session. Peter, any parting words, no, to our participants in the session?
Well, thank you first of all for attending, and I hope it's been an interesting and a stimulating session for you. I think the topic is really important, mapping morbidities and vulnerabilities for social inclusion. And I hope we've got across the basic point that digital technologies can do a lot, but as we approach making the most of the scarce resources that we have to invest in them, we do need to be thinking carefully about how we can improve, particularly the work that our frontline health workers are able to do, but also recognise that it makes sense for all of us to try and improve the behaviors of people, the healthy behaviors of people, and to leverage what we can from better quality knowledge to inform the way in which norms and customs and what's generally seen to be acceptable evolve in a healthier way. So digital technologies can help that. They can also hinder it, and we need to be aware of the opportunities and challenges simultaneously. But thank you very much for the opportunity to take part in this. And back to you, Dennis.
Thank you, Dr. Peter Drury. Yeah, I'd like to echo that a word of thanks, no, to the organizers on the union and of course the team from the Community Connect for making this session possible. We'd like to also thank everyone who participated in this session, and as we explore this particular area of convergence, no, between the use of non-communicable tools, non-communicable risk assessment tools, for more socially inclusive programs or initiatives. No? And as we said, no, this discussion attempts to look at a more comprehensive way, of the use of these particular tools. Of course, the more bridges to build, between these different health programs, as we have actually within the context of the health sector very segmented and very vertical programs that we hope digital technology, health technology, can help bridge, through these particular initiatives that we have discussed. So this is just one probable or possible way. This bridge can be created by expanding the use of non-communicable disease risk assessment tools to other social inclusion programs or other disease programs for that matter. So this is Dr. Dennis Batangan from Ateneo de Manila University in the Philippines, and Dr. Peter Drury from Drury Consulting Limited from the United Kingdom. We'd like to thank everyone for your time and inputs and participation in this community connect session of the Union Conference. Good day, everyone, and have a good day, have a good night, and have a good afternoon to everyone. Thanks.
Thanks, everybody. Thank you.
Thank you. Thank you. Thank you. Thank you, Marina.